Hey guys, Ross here from Fit for Life Physical Therapy. Today I wanted to go over the three-step system that I use with all of my patients. And really it's something that I've been able to teach patients a lot over the years, and I keep it simple. I really thought about ways to present this, but I've kind of described it in terms of really it's the LLS system, or what I like to call loosen, lengthen, strengthen. And it's worked well because with most non-complex conditions, really it follows the same pattern. And I've really found that it's the soft tissue quality, the pliability or lack thereof, that really causes a lot of the issues. It's repetitive stress, and it's the accumulation of. So if you've watched my videos before, you've heard me talk about the difference between compression versus decompression, and how if we can just do a little bit of that decompression, it can offset or attenuate the stresses that we place on our body. Now, this is the same pattern that I follow in the clinic. I go right through and I loosen everything up and then lengthen it and then strengthen it. And we'll talk about what each one means. But really it's just laying out the system so that you can actually rehab yourself. And I find the system works well whether you, one, are rehabbing yourself, or two, if you're trying to prevent injuries. And really they're the same. Really just the difference is there the presence of pain or not. So when we talk about the first L, or loosen, this is where our foam rolling comes in. And anyone that knows me or has watched my videos or has been treated by me know that I love foam rolling. I just think there's far too many benefits of muscle pliability to not do it. So this is where we can have our foam rolling. This would also be our lacrosse ball work that we would do, massage gun, if you wanted to add that in there. Anything that's going to improve your tissue pliability. Once we get into the lengthening piece, that's going to be our pure flexibility training that we would typically see. We would also see mobilizations, and that can be self-mobilizations, and really that's just going to be oscillations or end range stretching. Strengthening, this can be regular strengthening as in resistance training, or we can just think of it as strengthening our movement patterns, and this is just increasing the mind-body connection or increasing our neuromusculoskeletal efficiency with movement. But really it goes hand in hand. So we want to make sure that we loosen everything up, then we can actually lengthen it, and then we're actually optimizing movement with what we've just gained. So now not everyone has to go through all three steps. In an ideal world, we'd be able to do 33% of all of them and we'd be good to go. But depending where you fall on a spectrum, maybe you move a little too much. So you're hypermobile, you need less of these two, and you're maybe more into this range. Or let's say you are hypomobile, you don't have enough movement. Well, maybe we need to spend more time down here and a little less right here. Eventually we'll make our way so that then we're gonna have an even ratio of all of them. Now, in a case of, say, knee osteoarthritis, which is more of a hypomobility syndrome, if this were someone that wanted to use this system, I would certainly foam roll the thigh muscles, so the muscles on the front. I would use a lacrosse ball on the hamstrings and the calf muscles. And then I'd work on lengthening the hamstrings, and that's more so that I can increase knee extension. I would also do end range mobilization, so working on loading knee flexion, putting my leg up onto a step and slowly guiding myself into it. And then what I would do is I would strengthen my squat pattern, my step up pattern, whatever it is that may be the problem, Or if we look at shoulder pain, so I'm not picking a diagnosis, just generalized shoulder pain, I would foam roll probably my thoracic spine. I would use a lacrosse ball on my chest and then my rotator cuff. You can use the massage gun on those areas. You just want to be careful due to the bony prominences in the area. And then from here I'd go through and I'd probably work on flexibility training, maybe lengthen my pecs or my chest muscles if I'm rolled forward a little too much. And then I may work on overhead mobility with my glenohumeral joint or the shoulder itself. And then from there, I would just go ahead and start practicing overhead movements if that seemed to be what was bothering me, or if I needed to load it in a closed chain pattern, which would be more like a push-up or a plank. That would just strengthen that neuromuscular efficiency. So again, this is the pattern that I tend to take with everyone. it tends to work well, and just always be mindful that it's a spectrum. So, in an ideal world, no pain, we could do even amounts of all three, but that's rarely the case. Some people are going to need more at this end of the spectrum. Some people are going to need more down here. But again, for most non-complex, non-severe, non-irritable conditions, you can rehab yourself. So give this a shot. If you have any specific questions, just let me know, and thanks for watching.